Hello and welcome to this training video on the use of drug courts in dealing with addiction. I'm Mark Brennan, Project Director for Continuing Education Television at the Missouri Institute of Mental Health in St. Louis, Missouri. And with me today is Judge Daryl Stevens, who is the Judge at Superior Court of California, Butte County, Chico, California. He graduated from Golden Gate University with a Doctor of Jurisprudence degree. He was admitted to the bar in 1966 and practiced their law until 1989 when he was appointed to the bench. And to his left is Percy Menzies, who is president of Assisted Recovery Centers of America in St. Louis, Missouri. He spent 18 years in the pharmaceutical industry and was associate product manager for the medication Naltrexone. Welcome, gentlemen. I think the first question that would help us get on the right track to understanding this topic is, what is the intended outcome of the drug program that you have?
Well, the drug court program is to help people deal with their addiction. In the regular court system, people are really just churned through a system. They never address the underlying drug issue. 85% of those people who are arrested and convicted of crimes have a substance abuse problem, be it alcohol or drugs. To put somebody in jail or prison doesn't help with that behavior. It keeps them out of the system, perhaps, or out of the public for a while.
Right.
But they come right back in with the same difficulties they had before. Drug court attempts to treat the addiction, and through the use of coercing treatment, if you will, getting the person to treatment and making certain that they address the various issues they have. It's a concept that started in 1989, and it has grown and grown. There was a drug court in Florida. There are now 1,630 drug courts in the United States, 200 more in the planning stage. And as we are fond to say, and as has been proven, drug courts work. Drug courts work to get people off of welfare, out of the criminal justice system, and get them jobs, get them educated, give them a feeling of self-esteem, and then benefit their children and their families as well.
When you had mentioned a moment ago coercive treatment. When you were saying that, do you mean mandatory treatment as mandated by a court of law?
Absolutely.
Okay.
A person is convicted of a crime, and they are placed on court probation, or they are placed on probation.
Right.
And there are then conditions of probation.
Okay.
Among those conditions is that the person go to treatment that we feel is, and that the assessment shows is appropriate for that particular person. That they are tested on a random basis, but also regular basis, at least 3 times a week, hopefully, for drugs, to see whether or not they're complying with the order that they abstain from the use or possession of drugs, that they be ordered to go to Alcoholics Anonymous or Narcotics Anonymous, that they get a job, that they get a high school diploma or a GED, general education requirement, if they don't already have one, and generally they don't have one, that they learn how to present themselves in a job interview. You treat the whole person as opposed to just a particular part of that person. People who have drug addictions can have a number of psychological problems, mental health issues, and we try to find out, what are those issues? What's driving this addiction? Why is this person using? You know, people don't use just because they enjoy using. It lights up the brain, and they sometimes they enjoy the effect, but generally they're doing it for a different reason. They have no self-esteem. They have mental health issues. They're bipolar. They can just have any number of different problems, and we in drug court collaborate with the court system, with probation, public defenders, district attorneys, treatment, law enforcement, and instead of each one of us going our separate path, try to deal with this person's criminal behavior or the addictive behavior. We work together, and we still are down that path, but instead of going our separate ways, we are now joined together, and we collaborate and help that person just in his or her overall performance in life.
It's interesting that you had mentioned a holistic approach, because some of the folks out here that might be watching this video who are from the mental health arena kind of would understand that to be a comprehensive, multidisciplinary approach to the treatment of the individual. And it's refreshing to hear you say that in the court system that is also the case, that you're not just looking at one aspect, but the mental health folks might say you're looking at a wraparound approach.
Exactly.
In dealing with some of the folks that come through your court system. Well, let me play the devil's advocate for a moment and ask this question. Doesn't incarceration decrease the DUI offenses?
No.
And why would that be?
Because all you're doing is taking people out of the system, putting them in a jail or a prison. You're making society safer from that person for a limited period of time, but you can't put them away forever.
Right.
And they get out of jail or they get out of prison, they go right back to the same behavior.
Okay.
And they are still a danger. And I don't care whether it's DUI or whether it's drugs. DUI is, of course, a person who drives under the influence is a real danger to the public.
Sure.
And we are trying to reduce the recidivism. Somebody goes to jail or prison, they get out, the first thing they want is a drink. Or they want to use drugs. First thing. And they have not been told, how can you stop drinking? How can you stop using drugs? How can you use other techniques to deal with whatever your issues are? Society is not safer with just putting people away. I'm a conservative judge, and I will put somebody that I consider a danger to the public, I'll put them away in a minute. But I realize that isn't going to help in the long run. And DUI courts and drug courts have been developed with the long-range goal in mind. We cannot continue doing things the same old way. As a judge, the frustration before drug courts, before DUI courts, of seeing the same people come through the system. It's this cycle, and it's like presiding over a merry-go-round. They go around and around, they get off, and then they come right back. And then, of course, it's almost an exponential growth, because then you see their children and their children's children. This is attempting to, in cooperation with others, is attempting to deal with the underlying issue. For years, and I think mental health professionals hopefully will appreciate this, for years, treatment folks did not trust courts. As far as they were concerned, that judge was there just to put their patient away. And to the on the other side, judges didn't trust treatment. Because the treatment person wasn't leveling, and the treatment person was afraid of the judge putting the person away, so the treatment person wasn't leveling with the court to tell them what's really going on with this person. And we now, because we're all working together with probation and all of the other collaborators that I've mentioned, we now have a respect for each other, and we have an understanding of each other's approaches, and we work together. We're trained. Judges, by and large, have never been trained in mental health issues or in substance abuse issues any more than mental health providers have been trained in the court system. When we train everybody so that we gain a mutual respect of our various disciplines, and we pool our knowledge to help that person, the results are so far greater than what we used to do, just going our separate ways.
Well, let me ask you, since the context then, the framework for interaction has been put in place that creates the essence of drug court, how do we get from the context or the system of drug court to the efficacy of the drug court in conjunction with naltrexone?
Naltrexone is just a tool.
Okay.
In drug courts, or DUI courts. We have people who have addictions, and they have to use alcohol, they have to use certain drugs, and we use counseling. For years, we never used medications. And for years, of course, we didn't give diabetics insulin either.
Right.
Nor did we give people who had tuberculosis drugs. Thank heavens, in those two fields, those two diseases, we have realized that we've got to use medication. Naltrexone has been on the market for a long time, but people have had either no understanding of it or a lack of real understanding. And naltrexone, and Mr. Menzies can explain exactly how it works, but it blocks the receptor so that when the person drinks alcohol or uses an opiate, that the brain doesn't light up like it used to. You block the receptor. And that then aids you in treating that person and getting them the treatment that they need through counseling, one-on-one or in group. And it takes the pressure off them while they're going through the process of treatment. Now, why in heaven's name wouldn't we use that?
Exactly.
Because the opiate user or the alcoholic is, they want that. They've got issues, and as those issues come up, they medicate themselves. They medicate with either an opiate or some other drug or alcohol. Now, if we can provide another avenue of helping them deal with that desire, so that they don't desire the drug, they don't desire alcohol to deal with their issue, it just makes all the sense in the world. And we've seen it because we use it in our drug court and our DUI court, and we're the first court in the United States to use it, and we just have had too much success to not use it, to not encourage others to use it.
Well, since we're talking about the efficacy of this drug, Percy, could you talk to us about what the effect of naltrexone is and how it works?
I think before, I would like to go back a little further and give you the history of naltrexone. It was a drug developed by the federal government. They spent millions of dollars developing a drug in response to a specific need. And the need was to protect people who have gone through a period of detoxification. They're completely clean. Now they're coming back to their homes, or what we call the sights and sounds and places and people
of their addiction
associated with the prior addiction.
Right.
And they had observed that these people had a powerful reignition or rekindling of their prior addiction when they were exposed to these cues. Call it the classical Pavlovian conditioning. And something had to be done to protect these patients. They also realized that it was impossible, that the drug that they developed should be completely devoid of any addictive properties. Because if the drug had even a slight addiction property, there was a tendency for the patients to just latch onto this and become addicted to that.
Right.
So naltrexone was the first drug that was developed that was non-habit forming, did not produce a high, did not have any street value, and as the judge said, it created a protection, call it an insurance policy, from either accidentally or impulsively succumbing to opiate use.
And what time frame are we talking about, and what year was
The
that?
drug was developed in the late 60s,
Okay.
and the studies were undertaken in the 70s. And these were very rigorous studies under extremely adverse conditions in the prison systems and so on. And the drug was approved in 1984
Okay.
to treat people who have been detoxed from opiate addictions.
Okay. And so talk to me a little bit about how does the drug affect the person's use of any kind of drug that might be addictive, whether it be alcohol or opiates?
Okay. Opiates is one of the most extensively studied of all abusable drugs. And we also have learned that the opiates seem to enter the brain through a very narrow neurochemical pathway. And if we had found a way to block that neurochemical pathway, the opiates cannot enter in from any other source.
Are we talking about serotonin or dopamine?
We are talking about the neurochemical or neurotransmitter called endorphins.
Okay.
So endorphins is the neurochemical pathway through which opiates enter.
Okay.
And fortunately, from our understanding of neurochemistry and neuropharmacology, we have known that a drug like naltrexone is an antagonist. It completely blocks those pathways, preventing either the accidental or impulsive use of the drug.
Okay.
And that was the initial hypothesis which turned out to be clinically very relevant.
Okay.
What was even more serendipitous was way back that later on they found that alcohol and opiates have a common neurochemical pathway.
And what is that?
And that is the endorphins.
Okay.
Whether you take the first dose of heroin or you take alcohol, both will cause the release of endorphins.
Mhm.
And that priming effect of endorphin release is what leads to the addictive behavior.
Okay.
So that gives you the high, you feel good, you want to take a second drink, and you just go down the spiral.
Okay.
By short-circuiting it, by breaking that the addiction cycle, you give the patient a chance to get well.
Okay. So let me ask both of you, and you can answer as you want to. If I am a person who has been presented in your court, and I've had several previous arrests and sentencing for DUI or what have you, and now I'm appearing in your court and we're in drug court, what would be now the course of action that you would take with me, given what we've talked about?
Presumably the person has been convicted of the offense, because we get them after they've entered a plea of guilty, or they've gone to a jury trial. And I would place them on probation. And one of the terms and conditions of probation would be that they go to a treatment not a treatment program. They go to a clinic.
Okay.
To see or their own medical doctor to obtain a prescription for naltrexone after tests had been run. That they would be ordered to obtain a prescription for the naltrexone, to have that filled, and then to ingest it before a pharmacist or at a hospital. 2 tablets on Monday, 2 tablets on Wednesday, 3 on Friday. The ideal is to have them take it every day, but that's not practical. They would then have the pharmacist or the hospital would then sign a log to indicate the person did in fact take the medication. They saw them take it. The pharmacist tickled their throat, made them open their mouth to make sure that they'd taken it. The person would also be ordered to go to treatment, because this naltrexone is not a magic bullet.
Sure.
It's pretty close to it, but you have to couple it with treatment. And so that they would go through treatment through mental health or behavioral health. They would either be going through group sessions or to one-on-one sessions. We might send them to Catalyst if it was a woman who had a number of issues of having been mistreated. We would identify the different avenues of treatment that were necessary for that particular person. If they had a co-occurring disorder, we would begin treating that as well.
Okay.
They would be ordered to totally abstain from the use or possession of alcohol and controlled substances, and they would be tested on a random but regular basis. They'd be assigned a color, and they would have to call a telephone number every day. If their color was red and it said, the telephone message said today's color is red, they would have to present themselves for a urine sample within 8 hours of that telephone call. They would have to get if they didn't have a GED or a high school diploma, they would be required to begin taking the courses so that they could get that. They don't have a job, we would send them to job training. We'd teach them how to dress, how to wear a tie, how to apply for a job, and I don't care whether it's a ditch digger's job. We teach them how to apply for that job so that they give a good impression. Perhaps the most important thing, however, is that the person then has to come back to court and face a judge for a review on a regular basis, and to show that they are complying with the orders or they're not. And that's key, because probation's been around for a long time.
Sure.
And people can be ordered to do things, but they don't do them. And even though the probation officer is doing his or her job, and I have the highest respect, they don't wear black robes. And there are studies, and the data show that if the person has to come back to court and the judge looks at their overall performance and praises them if they're doing well, or criticizes them if they're not doing well, that makes all the difference in the world in their performance. The performance rates skyrocket once you introduce the judge in this whole procedure. And that's why DUI courts work, drug courts, all of the other collaborative courts, because they're called collaborative courts. We are collaborating in this approach. And they will come back to court in the beginning every 2 weeks, 3 weeks, 4 weeks. It depends upon the drug court. It's a non-adversarial proceeding, so that the defendant cannot work the system as he or she has done before.
Okay.
We do a staffing with everybody who's involved. We do that beforehand, before we go into court, with the appropriate releases, and we discuss it, and we hash out any issues there may be, so that when we go into the courtroom and the defendant is there, we have a united front.
And everyone is clear about
And
what's
everybody
going on.
is very clear. In fact, rarely does the public defender will be heard, or the defense lawyer will be heard in staffing.
Oh, okay.
And the person's rights are always protected. But when you go into the courtroom, court is theater, and the lawyers rarely say anything. The judge has a direct discussion
With this person.
with the defendant. That's, again, is totally different than your usual court setting.
Sure.
And the defendant talks to the judge. And for example, if somebody's doing well, or let's say not doing well, I'll say, George, what's going on? Who are you hanging with?
Sure.
You know, what problems are you having? And if they're doing well, I can say, George, why is it working?
Sure.
What are you doing? You're doing great. They see in a courtroom setting a person in a position of authority saying something positive. They've never seen that before.
Right.
By the same token, it's almost like a family, and people who come into drug courts or DUI courts for the first time say, you know, it's very paternal or maternal, because here's the judge saying to his children, in effect, kids, you're doing great, or you're not doing great. And that's what gives them the incentive to do well.
Well, it sounds like through this period of time where the drug court has been established and has worked, several issues have come up that have been taken care of and have been proven to be effective. One, it sounds as if the folks that you're getting into your court who are going into this program and who may be on Naltrexone, for instance, as a tool, are finding themselves in a better situation than they would have before. It sounds also as if there's more collaboration between the court and other service providers in the community where drug courts exist. And it also sounds as if Naltrexone is effective, at least, in reducing some of the impact that drugs and alcohol may have on an individual and their support system. Is that accurate?
Very much so. I think what Naltrexone does, it is like the insurance policy, it's like the Teflon coating, the scaffolding that really helps them to put their life back together. Because remember, these people are going to be under so many forces are working against them. They handle stress differently.
Certainly.
They may have a good resolve not to use drugs, but there are other things. Hey, the drug dealer ran into them at the gas station, and they said, "Hey, I haven't seen you for a while, George. I got some really good stuff." And we know in addictions, most of the addictive, that when you use drugs, it does not happen through careful planning. It is very impulsive. And you have to protect. Think about that, you have a broken leg. And when you place the cast, you're allowing that bone to heal. But like the cast is not only for the rest of your life. Same thing, Naltrexone is not to be usually used for about 3 to 6 months. And then hopefully all the other components of treatment, the behavioral modifications are kicked in, and the patient is now well on his or her way to a healthy, normal life.
And most importantly, Judge, I think, would it be safe to assume then that there are fewer folks in the penal system or in jail as a result of the drug court process?
Oh, absolutely.
Okay.
In fact, in California, the correctional officers union is extremely powerful, and they get money from the state because of that. Drug courts now are getting part of our funding from the penal system,
that's
from the
wonderful.
Correctional Institute.
Yeah.
And I can tell you, if it didn't work,
You wouldn't get
we
the
wouldn't
bucks.
be getting that money,
Sure.
because their budget was reduced, and that reduction was then used to fund, is being used now to fund drug courts. You know, it costs $25,000 to $30,000 to put somebody in a state prison. That's a lot of money.
Yeah.
It costs about $2,000 a year to put them through drug court.
Well, see, that's a lot of savings.
So, savings in terms of money,
And
savings in terms of them coming back, savings in terms of their children coming back.
certainly.
The social welfare costs of drug addiction are just astronomical. And if we can reduce that, and if we can reduce the recidivism rate is just, you can't believe what it's like when somebody goes to prison or jail without the treatment.
Sure.
They go out and they repeat the same thing.
Revolving door.
But we're stopping that.
Well, in summary, gentlemen, is there anything that you would like to leave with the audience that they can hold on to in terms of this training program on the use of drug courts with addiction?
I would, and I think that the message that we have found from the people who go through drug court is they're finding people care. I know people in treatment care. And when they see that everybody cares, and I can't use the language that was used by one of our persons in treatment, but he was observing after he had been through a court session. He said, you know, that man, I was referring to me in this instance, that man really does give a hoot.
Sure.
He really cares about me.
That's a wonderful thing.
And if I can be, the judge can be the spokesperson, the leader of a team of mental health professionals and treatment professionals, to let those people know we do care. But we care enough that if you don't do the program, that we're going to take steps to correct the behavior that we don't want.
Sure.
And so I would hope that the mental health people and treatment folks have an appreciation for the other disciplines and back, so that we can all work together to save people and save money.
Percy, would you have any last?
Yes, I think these are truly exciting times, because Naltrexone was the first of the new breed of medications that came out that were developed to treat people with addictive disorders. The newer medications are just as exciting, and for the first time we can not only treat the addictive disorder but also help the professionals treat the other co-occurring disorders. And this is a major problem today with people who have what are known as dual diagnosed co-occurring disorders. And for the first time you can treat both simultaneously within the setting of the drug courts. And the judges are very appreciative of these medications, because they are very much assured that these medications are likely to be misused, abused, overdosed, sold on the street. They are going to be used specifically for the purpose for which they were intended. So these are truly exciting times in the field of treatment of addictive disorders.
Well, I appreciate you coming in, gentlemen. You have really helped us to understand the issue of drug use and the use of courts with addictive folks. I would encourage everyone who is looking at this video in the audience to check out the key concepts, to look over the glossary of terms prior to taking your test, and you should have no problem being successful with the test. I appreciate your time. Thanks, and good health.